COPD stands for chronic obstructive pulmonary disease, but we can think of it as a little bit of mixture of several diseases that we're familiar with: asthma, emphysema, and chronic bronchitis. What happens in patients who have COPD is that they are all pretty much smokers. But what happens is when you get smoking exposure, it damages the lung tissue. When that happens, you lose the elasticity and the sponginess of the lung. It's harder to exchange oxygen, and also your mucus glands in the lungs can become damaged. After that, it becomes increasingly harder to breathe. If you have mild COPD, you might get by with just using an inhaler as needed. But as the disease progresses, you might need something more, long-acting medications to keep not only the airway open, but also to decrease the inflammation of the airway. Sometimes people even need bursts of steroids or antibiotics if their symptoms are worsening. The other therapy that we use is called pulmonary rehab, and we have a very good pulmonary rehab program here at Wood County. But in order to do that, you have to have a breathing test and you have to have the necessary severity. Overall, even though COPD is thought of as a disease that people get worried about, it is a chronic disease, and depending on how you take care of yourself, people can live lives for a long time and have good quality of life. But the most important thing, of course, is to stop smoking.